Boris Johnson has to go. The way he's conscripted his cabinet ministers to defend his wretched Rasputin, Dominic Cummings, is a symptom of much more. A tin pot tyrant act, trying to sideline scientific debate, doing everything he does in the pandemic with the priority of paying profits to his mates, to Serco or Deloitte or to others, and evading responsibility. On 20th of May, Boris Johnson told Parliament, "We will have a test and track and trace operation that will be world-beating, and yes, it will be in place by 1st of June. Leave aside the sickly talk of world-beating. Dido Harding, another posh Tory, without relevant education or expertise, has been brought in to run the manual track and trace. On the 28th of May, she admitted it would not be in full operation until the end of June. Back on 20th of March, the government said it was planning a smartphone virus tracing app to be put in circulation when the lockdown was eased. The contract for the app, with a US software company, has been managed by Matthew Gould, the boss of NHSX, the digital policy bit of the NHS. Gould has no education or expertise in medicine, public health or information technology, but he did go to school with George Osborne and then to Cambridge. In late April, the Tories promised the app for mid-May. We're still waiting. In other countries, track and trace has been run by local public health employees, augmented by police who, whatever else about them, are permanent public sector employees with some relevant training and some slight level of accountability. Under Johnson, the tracers are being recruited by Serco, an outsourcing giant with no relevant expertise, but with Rupert Soames as CEO, from an old Tory family. Serco is hiring them for 12-week gigs on minimum wage or maybe a bit more and giving them scant training. Track and trace at best is only part of a policy against the virus. To work at all, it needs a smaller number of cases to be tracked than currently in Britain. John Edmonds, a professor at the London School of Hygiene and Tropical Medicine and a member of the government's advisory committee, said on 29th of May that he estimated 8,000 new infections a day outside hospitals and care homes. The daily number of new confirmed and tested cases in Britain is going down slowly, but is still 4 times 11 in France and Italy. So is the daily number of deaths. Back in January to March, when the government ran track and trace before dropping it in mid-March for lack of testing capacity, the average delay for getting test results and then reaching the close contacts of someone infected was 5 days. As a recent report by scientists convened by the Royal Society comments, by the time contacts were found, half of their onward transmissions had already occurred. To work better than it worked then, the operation needs quicker test results. Taiwan can provide them in 4 hours. Vietnam in 5 hours. Britain, with its big biotech industry, its big university biology departments, and its riches, but its Tory government, 2 days if you're lucky. The testing is organised by Deloitte, a firm of accountants, not people with medical knowledge. Then, if the contacts are traced, they need to be able to self-isolate. They need isolation pay, but not even all care home workers have that yet. The case numbers won't be kept down long term without PPE being available for workers across the board. Even in the NHS, securing sufficient levels of PPE is still a challenge, according to the boss of NHS providers, an umbrella body for NHS trusts. Speaking on the 25th of May, the NHS does not have a sustainable supply in place and really effective testing of NHS staff and patients. Dentists, due to reopen on 8th of June, says they can't get PPE. A new report shows how the NHS supply chain has been divided into 11 contracted out segments. Each contractor is a middleman, which then does exclusive deals with suppliers, 4 layers of profit taking, and as many layers of buck passing. The labour movement must demand requisitioning of industry for direct public provision of PPE and tests, workers' control over reopenings, isolation pay for all, and work or full pay for the workers now facing job cuts. We need to get rid of the Tory government and the whole nexus of privilege and profiteering which serves it. Getting rid of Johnson will be a start. It would be hard, even for a Tory successor, to get away with this tin pot tyrant act, like his attempt to shut down Parliament last year and his rush for a hard Brexit formula before 30th of June. We must make Labour speak out.